Today students, today is about perineum and urogenital diaphragm. This is the important structure for pelvis area. The perineum, it's a diamond-shaped region. The perineum is a diamond-shaped region below the pelvic diaphragm. Perineum is a diamond-shaped region below the pelvic diaphragm. The boundaries of the perineum are of the pelvic out. Boundaries of the perineum are those of pelvic outlet, mainly for lower border of the pubic symphysis, rami of the pubae and ischium, ischial tuberosity, then saccade tubulus ligament and tip of coccygeus. Then they said perineum is a two triangles are formed. The perineum is divided into anterior and posterior triangle so by joining by the ischial tuberosity with the imaginal line. Okay, and the perineum is divided into two anterior and posterior triangle by joining the ischial tuberosity is within imaginal line. The urogenital region, that is urogenital triangle, is the anterior present different the male and female. Anal region is present in the anal triangle. This is a posterior similar in the both sexes. Okay, then we'll go for anal triangle. It's contain the anus, sphincter, also the ischiocanal fossa on the either side of the both the male females. Then content of the anal triangle is the anal aperture, ischiocanal fossa, external anal sphincter. The urogenital region is mainly for superficial fascia. Is a superficial fascia. Then is a fatty layer. Is a fatty layer, membranous layer. Superficial fascia of the perineum or called the Coolidge fascia, attached to the posterior part of urogenital diaphragm, lateral to the margin of the pubic arch and ischial tuberosity, anteriorly to this can with the darters of the scrotum, fascia of the penis, and the scarpa fascia. Then is a diagrammatical structure of the pelvic fascia. The urogenital region is a deep fascia. The deep fascia is the superficial fascia of urogenital diaphragm, inferior fascia of the urogenital diaphragm. Between the superficial fascia of the urogenital diaphragm and the inferior fascia of the urogenital diaphragm. Okay. Then attached to the posterior part of the urogenital diaphragm, laterally to the pubic arch, in front of the fused together forming the so-called transverse perineal ligament. Then we'll go for the urogenital region. Two spaces is the present. One is a deep perineal space. Second is a superficial perineal space. Okay, but in this diagram, we'll see about the superficial fascia of the urogenital diagram. Is next we will go for deep perineal space. Below this inferior fascia of the urogenital diaphragm. In this below superficial perineal space, superficial fascia of the perineum. Okay. Also, between the superficial fascia and inferior fascia of the diaphragm is the between the space is a deep perineal space. Then superficial fascia of the perineum is above the space is the superficial perineal space. In this superficial fascia of the perineum is three scarpa fascia of the penis, and darters of the scrotum. Then the urogenital region, the superficial perineal space lies between the inferior fascia of the urogenital diaphragm and the superficial fascia of the perineum. Then it goes to begin and laterally. Then urogenital region, the superficial perineal space is anteriorly the space communicate with the potential space lying between the scarpa fascia and the anterior abdominal muscles. In rupture of the cavernous part of the urethra, urine can exudate from the scrotum upward in front of pubic symphysis to anterior abdominal to deep to scarpa fascia. Then we go for urogenital diagram in the superficial perineal space. Content is the posterior part mainly for superficial transverse muscles of perineum. The lateral part is a crus penis or male, crus of the celitoris is a female, and ischia cavernous is covering them. Then central part is the bulb of urethra is a male, bulb of vestibula is a female, and the bulb of cavernous is covering them. The branches of the pudendal nerve and internal pudendal vessels. Then you'll go for in this area the superficial perineal space content is the posterior part, superficial transverse perineal muscles of perineum, lateral part is crus penis is a male, crus cilitus is female, central part is bulba urethra. The deep perineal space is the closed space that is contained the between superior and inferior fascia of the urethral diaphragm. Content is the deep transverse muscles of perineum, bulbourethral gland, sphincter of urethra, arteries and veins and nerves. The urethral diaphragm is a triangular shape, is formed by the sphincter of urethra, deep transverse muscles, perineal muscles, superior and inferior fascia of the urogenital diaphragm. The perineal central tendon is a wedge-shaped fibromuscular mass in female between anal canal and the lower end of vagina. Anal canal and lower end of vagina. Female between anal canal and root of penis. The larger in the female, larger in the male, female than the male. The final support to posterior vaginal wall of vagina. The perineal placenta known as the spinstock ani externus, levator ani, superficial transverse muscles of perineum, deep transverse muscle of perineum, bulbocavernous spinstock urethra. Okay, student. Okay, thank you. Next is about next class.